welcome to Medicare 101. I'm Ben Rothering, and I am the Medicare specialist here at WDS Health. The things that I do on a daily basis helping people with their Medicare needs, whether it's finding them a supplement or an advantage plan, helping them figure out what kind of prescription drug coverage they might need. But a lot of times when people are coming off of group coverage, they are also looking for something to continue their dental, their vision coverage. I also help people with extended cancer protection, funeral and estate trusts, and a wide variety of life insurance opportunities. You may or may not have some of these things covered, but my job is to make sure that any of the gaps that you see fit that you might need, that we make sure we cover those gaps. Now, as we go through today, the things that we're going to talk about, we're going to talk a little bit about Social Security, but more how it relates to Medicare. We're going to talk about your Medicare eligibility. How do you enroll in Medicare? The different enrollment periods. Whether you retire early or if you decide that you're going to work beyond 65 and beyond Medicare eligibility age. What happens if there's a spouse in the mix, and how do we find coverage? There are 4 different parts to Medicare. And what are your options beyond Medicare? Now, when we start, we'll just start very basic. Medicare, it's a federally funded program, going to be more for people that are turning 65 or older, but it can be for people who are under the age of 65 if you qualify due to a disability or something like permanent kidney failure. Now, not to be confused with Medicaid, which is federal and state funded, and that's going to be more for people with limited resources. Now, Medicare was started in 1965 and it's run by CMS, which is Center for Medicare and Medicaid Services. And over the years, they've tried to enhance Medicare. So by adding prescription drug coverage, and then within that, the Inflation Reduction Act that came up a number of years ago had phases that helped make the drug plans a little bit better. So making insulins $35 a month, or catastrophic coverage, making it so that your medications are free when you get into catastrophic coverage, getting rid of the donut hole, adding a cap that you can spend on your medications each year. So, and then adding preventive care when the Affordable Care Act came around in 2010. So then there are a lot of different resources that are out there that you can look to get some of those questions answered as well. Now, signing up for Medicare, there's really 3 ways that you can do it. In my opinion, the easiest way is to go online to ssa.gov and create an online account. Now, they're going to force you to create that account using either login.gov or id.me. So whichever one you're most comfortable with. But once you have that account online, it can make enrolling in Medicare very, very easy. Your other options, you could certainly contact Social Security and set up a phone appointment. Now, they're usually a month or 2 behind, but you can certainly do that as well. Or you could go down to the Social Security office and set it up with them as well. Now, when we go through this, I'm going to be referring to 2 different groups of people. One group is going to be the people who are not yet receiving their Social Security benefit, and the other group is already receiving Social Security. The reason for that is because if you are not yet receiving Social Security and you are looking to go on to Medicare, then we will actually physically have to do that enrollment using one of the methods I just described previously. Now, if you are already receiving Social Security, and let's say you're getting ready to turn 65, well, the government knows you're turning 65, and they are going to automatically enroll you in Medicare, A and B, and they're going to send you your card in the mail, and it's going to get delivered roughly 3 months ahead of your birth month. Okay. Now, Part A should be premium free for most people, as long as you or a spouse, you've worked long enough, you've paid your taxes. Part A should be premium free for you. Now, everybody's going to fall into one of these 3 enrollment periods. I'm going to start with number 1, and I'm going to skip down to number 3, and I'll come back to number 2. So the initial enrollment period is a 7-month window. It starts 3 months before your birth month. It includes your birth month and goes 3 months after. Now, this is for people who are approaching age 65 looking to go on Medicare at that time. Now, if that is you, if you fall into this category, I highly recommend taking advantage of those 3 months ahead of time. We're working with the government, not always fast, but it will certainly help make sure that things get set up in a timely manner and they begin as soon as you need it to begin. Now, the special enrollment period, that's going to be for someone who didn't take Medicare or didn't take all parts of Medicare when they turned 65. And that's probably because they or a spouse was still working and they had group coverage through a large group employer. And when that group insurance is going to end, could be a couple of years down the line, then that becomes a qualifying event. And whoever didn't take Medicare when they should have at 65, they now fall into this special enrollment period where you can go pick up all the other parts of Medicare and any other options you have without incurring a penalty for picking it up at a later date. We will just have to show proof of that prior creditable coverage. Now, the enrollment period we don't want to fall into is the general enrollment period. So this is going to be for someone who is essentially uninsured and they turned 65 and didn't take Medicare. And let's say a couple years goes by. And now they're thinking, well, I'm getting a little bit older. Maybe I should go on and get Medicare. Well, now they are in this general enrollment period. So they would have to wait until January of the next year in order to enroll in Medicare. And then Medicare will begin the first day of the next month. So if you enroll in January, it would begin February 1st. If you enroll in February, March 1st. Now, this is the opportunity where someone will get a penalty, and they're going to get a 10% penalty per year that they delayed their enrollment into Medicare. So we really do not want to fall into the general enrollment period. And the initial and the special enrollment periods are very important timeframes to take advantage of, because during those two enrollment periods, you can't be asked any health questions. Your current or prior health history cannot be used against you. You can get anything you need, whatever you think is the pick of the litter, and nobody can deny you that coverage. Now, signing up for Part B, again, when we go back to those two groups of people, if you are not taking Social Security, then we will have to do that enrollment into Part B. But if you are already receiving Social Security and approaching 65, you will be automatically enrolled. Now, what happens if you or a spouse plan to keep working for that large group employer beyond 65 and you don't want to take Part B? Because Part B carries a premium with it. And if you have a large group employer, and when I say large group, I mean larger than 20 employees, then what would happen is the group insurance would remain primary. So why would we want to pay a Part B premium when it's going to sit secondary? So if you are receiving Social Security and you are mailed your Medicare card, but you don't want Part B at this time, you just got to flip that card over and read the instructions, check the box saying you don't want it, and send it back to them right away. And then they'll send you a new card with Part A on it only. And then you can pick up Part B during a special enrollment period whenever your group insurance is going to end. Now, like I said, Part B does carry a premium with it. And the way that they determine what your Part B premium is going to be is based on how you filed your taxes from 2 years prior. So right now they're looking at 2024, and they're going to be looking at your modified adjusted gross. So when you enroll in Medicare, you're essentially giving them permission to go talk to the IRS to take a look at your tax returns. And they're going to put you in one of these brackets, whether you file individually or jointly. Okay. Now, every year they are doing that 2-year look back. So next year, then, when we're in 2027, they're going to look at 25 and those tax returns and so on. So each year your premiums could change based on how your income changes. Now, if they put you in one of these higher brackets, what they do is they call that an IRMA. And IRMA is called an income-related monthly adjustment amount. Basically means that you have a higher income, so you're going to pay a higher amount for your Part B premium. There will also be an additional IRMA for your drug plan premium. Okay. Now, how do we pay those Part B premiums? Well, going back to our two groups, if you are not yet drawing Social Security, they are going to start out by billing you quarterly. So you will get a bill in the mail and it will show you it's for months January, February, March, or whatever months they have you starting at. Okay. Now, if you are drawing Social Security, then once that gets into the system, what they're going to do is deduct the monthly Part B premium from your Social Security benefit before depositing that money into your account. So now we get to the four parts of Medicare, or what we call the alphabet soup. So A, B, C, and D. A is all about your inpatient hospitalization. B is all about your outpatient medical. Part C is privatized Medicare or Advantage plans. And Part D is prescription drug coverage. So we're going to break each of these down individually. And as we do that, we're going to slowly fill in portions of this healthcare pie to see where is Medicare covering certain things, but where are the gaps left over? So talking about Part A again is all about your inpatient hospitalization. If you are admitted to the hospital, and I stress the word admitted because there's a significant difference between being admitted or just being kept or held for observation. Now, that doesn't mean you're not covered. It's who's covering it, and is Medicare going to continue to follow you? And I'll explain that in just a moment here. So if you are admitted to the hospital, then Part A is going to kick in, and that initiates this 60-day benefit period that you see here on the screen. Now, Medicare is going to pick up everything in those first 60 days after the Part A deductible has been paid. The Part A deductible this year is that $1,736 you see there in the middle of the page. Now, if you stay in the hospital beyond those 60 days, now you have these daily hospital copays. And if you get to days 91 through 150, those 60 days are called lifetime reserve days. They are one-time use days, which means if you were admitted to the hospital, and let's say you were in there for 95 consecutive days, you have now used 5 out of those 60 lifetime reserve days. Now, the most important thing I want you to understand about this slide here is that Part A works on a benefit period. Those 60 days could actually recur potentially every 60 days. Because if you are admitted to the hospital, and let's say you're discharged, and 3 months goes by, and now you're admitted to the hospital again, well, now a new 60-day benefit period starts over, which means a new Part A deductible needs to be paid. So this is where I'll get questions on occasion where someone will say, I've heard about Medicare and how much they discount all the medical prices and then they cover a significant portion. So do I really need anything else? And my answer to that is you don't have to. There's no law saying you have to go get an Advantage plan or a supplement. However, the problem is that original Medicare, A and B, is an uncapped liability. So those charges aren't going to stop. Which means if you are admitted to the hospital 3, 4, maybe 5 times a year and it falls, beyond 60 days each of those times, that means that Part A deductible is going to need to be paid 3, 4, 5 times a year. And most people don't want to have to do that. That's where getting something like a Medicare supplement or an Advantage plan is going to give you that max out of pocket so that the tab doesn't keep running on you. Now, continuing with Part A benefits, if you know that upon being discharged from the hospital that they're saying you need to go into a skilled nursing facility, into some rehab. Here, this works on a 20-day benefit period, and Medicare is going to cover everything in those 20 days, assuming we follow their rules. The rules are you have to have been officially admitted to the hospital for a minimum of 3 days, or 3 midnights is what it is, and then go to a Medicare-approved facility within 30 days of being discharged from the hospital. So again, as long as we follow Medicare's rules, then they will pick up the first 20 days at a skilled nursing facility. They leave a little bit behind for the next 80 days, and beyond 100 days, well, that's where you're going to come into play and have to pay. But those 20 days, again, that's a benefit period, so it can start over. Then to finish up the Part A benefits, so inpatient blood work, Medicare won't pick up the first 3 pints of blood each year, but they'll pick up the rest. Home health, Medicare is going to cover everything that is quote unquote medically necessary, which is a really important term. Everything that we do, we have to make sure that our providers are proving medical necessity so that Medicare is on board, right? We can't just go do any test we want anytime. It has to be proven that, yes, in fact, we need this test or this procedure. It's medically necessary for that patient. That way, Medicare will be on board. And then the hospice benefit is a really amazing benefit here. Part A really kind of jumps in and takes over pretty much all the costs. So this is how Part A is going to jump in and fill in portions of that healthcare pie. Now, Part B is all about your regular doctoring, specialist visits, therapies, durable medical equipment, ambulance services, and preventive care. And when you start Part B for the first time, you have 12 months to do what they call a Welcome to Medicare preventive visit. And every year after that, Medicare is going to pick up what they call a wellness visit. Now, it's important to know that neither of these is a full-fledged physical exam like we used to be able to get. It's a check-in with your doctor. You're going to fill out a questionnaire. You'll review that questionnaire, memorize 3 to 5 words for a memory test. They'll probably check your eyes, your ears, your nose, review your medications, and then say, see you in a year. And so it's roughly 20, 30 minutes. For all the internal med doctors that I've talked to, they've all kind of said a similar thing, that it's not super long. It's a way to just check in with your doctor each year and make sure that nothing's changed. Now, Part B does include preventive services, and Medicare has a list of preventive services and the frequency that they want to cover them. Now, here's a few that most people are somewhat familiar with. So Medicare is going to pick up one abdominal aortic aneurysm screening in your life. Mammograms, they'll do once a year. Blood work every 5 years. Colonoscopies every 10 years. Now, some of you might be saying, hey, I went in and I had a colonoscopy and they found polyps, and now my doctor says I got to come in every 5 years or maybe every 3 years and be a frequent flyer. Well, again, if that's the case, then they should be proving medical necessity to Medicare to say, we got to see this person sooner than 10 years. That way, Medicare will reduce that time frame and jump on board sooner. Now, when we talk about vaccines, if you are someone who goes and gets your vaccines, Medicare Part B, they cover flu shots every year, pneumococcal, COVID shots. Part of the Inflation Reduction Act forced drug plans to cover things like the shingles shot or RSV. Now, as a pro tip, if I can recommend, if you are someone who goes to get your vaccines, then I highly recommend doing it at the pharmacy. Don't go to the doctor's office to do it. It'll make your life a lot easier because the pharmacy is going to bill Part B. They will also bill your drug plan, and everything should be set. Okay. If you do it at the doctor's office is only going to bill Part B. Then you would have to send in a claim to your doctor or to your drug plan and wait for them to respond. And then in addition, the doctor's office might charge you for the administration of that shot, where that won't happen if you get it at a pharmacy. Now, Part B is a little different than Part A. If you recall, Part A had that 60-day benefit period. Part B works on an annual deductible, and this year the annual deductible is that $283 you see on the screen. Now, last year it was $257, so gives you an idea of the jumps that Medicare takes each year and how they change their numbers. So prior to Medicare Part B picking up 80% of your outpatient services, that $283 needs to be paid. But after that, then anything else that Medicare Part B is on board with, they're going to pick up 80% of the Medicare approved amount, and they'll leave 20% behind. Part B is going to pick up 100% of clinical lab services for diagnostics. We talked a little bit about the preventive services as well, but nothing that exceeds the Medicare approved amount. So what does that mean? That means that, one, you always want to make sure you're at a facility that accepts and bills Medicare. But two, you also want to make sure that your providers accept Medicare's discounted rate or accept assignment. And what that means is Medicare has their idea of what they think is an appropriate charge for any particular procedure. Basically, they're going to discount it significantly. And if the doctor accepts assignment, then they'll take that discounted rate. So let me give you an example. If you go to the doctor and the total bill is $115, and Medicare looks at it and they say, well, we approve $100 of that $115. If the provider accepts Medicare's discounted rate, they say, forget that $15, we'll take the $100, and then Medicare covers 80% of the $100, and they leave the 20% behind. But if the provider does not accept Medicare's discounted rate, they can actually charge 15% more than the Medicare approved amount. And that difference, that is called an excess charge. And Medicare doesn't pick up those excess charges. What does original Medicare not cover? Well, they aren't going to cover anything as far as routine dental, like cleanings, exams, Crowns, bridges, fillings, root canals. They aren't going to cover routine vision exams or refraction, hearing, any foot care. They also aren't going to cover materials, so things like glasses, contacts, hearing aids, orthotics. Medicare doesn't cover those things. Medicare doesn't cover anything long-term care, like in a nursing home, alternative medicine. If you're someone who likes to take more of a holistic approach, that's fine, but that's going to be an out-of-pocket expense. Medicare is only going to cover things that have been, put through the FDA, approved, and all that. Cosmetic surgeries are not covered, personal care. Medicare will go all over the country with you, but they will not cross the border. Prescription drugs, we're going to talk about that coverage shortly here, and nothing non-medical. So examples of that would be, let's say you decide that you want to go get a second opinion and you found a specialist that works halfway across the country, okay? They aren't going to help you cover the travel costs or lodging costs, or if you're going through treatment and you lose your hair and you want a wig, Medicare isn't going to pick that up either, okay? So this is how Part B is going to jump in and slowly fill in other portions of that healthcare pie. But you can see there's a lot of gaps left there. And again, you may have some of those gaps already filled out, but maybe this is showing you some things that you never knew needed to be covered, and we need to talk about those things. So we finished up with A and B. Let's move on to Part C, which is privatized Medicare, or Medicare Part C, Medicare Advantage plan. So if you decide to go the route of an Advantage plan, you now have a private insurance company that's in the driver's seat, and they are now replacing original Medicare A and B. Now, you still have to pay that Part B premium, however that's getting paid, again, whether you're drawing Social Security or not, but your Part B premium is now essentially getting rerouted to that private insurance company that's administering the Advantage plan. Now, with that, this is going to be similar to your group insurance through an employer, where now you have an HMO or a PPO. So you have a network of doctors and certain facilities that you need to utilize, and you need referrals to get a second opinion outside of that network. Now, when it says that Advantage plans are optionally renewable every year, what that means is that they have to renew their agreement with Medicare every single year. So technically, yeah, an Advantage plan could cancel on you if they don't come to an agreement, then it might go away. Because Advantage plans, they work in service areas, so they're going to grab onto a handful of counties, okay? And every year when they're reviewing their plans, they might add a county into that network, or they might cut a county out. And if you live in the county that just got cut out, then it's going to cancel on you at the end of the year. Now, that creates a new special enrollment period for you. So you get to go pick up anything you want, no questions asked, starting January 1st. Okay. Out-of-pocket costs can change over time. So a real basic way of explaining how Advantage plans works. An Advantage plan is going to be more of a pay little to nothing up front and have a max out-of-pocket. So you've all probably seen commercials, especially towards the end of the year, where Joe Namath or Walker Texas Ranger are telling you that they've got a great Advantage plan in your area and you can pay little to no premium and you get all these extra benefits. So yes, we could find you an Advantage plan where you have no monthly premium. And let's say that Advantage plan gives you a max out of pocket of $6,000. Then what they're going to do is they're just going to outline all of your benefits and tell you, here is your copay for any particular service. So maybe it's a $15 copay to go see your primary doctor, or a $60 copay to see a specialist, or maybe you have to pay $400 for each of the first 6 or 7 days that you are admitted to the hospital. All of those copays are counting towards your max out of pocket. Now, out of pocket costs can change over time because every year, these companies that are administering Advantage plans, they can change the coverage within, okay? And all those numbers can go up and down. Now, all of these Advantage plans, they have guidelines they have to follow. So they have to be a part of what original Medicare would normally cover as medically necessary. It's just they get to structure within those guidelines however they want. So copays can go up or down. Max out of pocket could go up or down. The premiums can go up or down. Okay. Now, other benefits of an Advantage plan is that it's going to bundle everything all together, right? So we could find you an Advantage plan that does include prescription drug coverage, and they might include some sort of dental, vision, hearing coverage that might give you, some help towards some of those material things like glasses, contacts, hearing aids. But it's important to understand that all of these Advantage plans, while they follow all these guidelines, they can structure their plans how they want. So we could look at 3 different Advantage plans side by side, and maybe they all say they offer dental coverage, but we really want to dig deeper and see what kind of dental coverage are they offering, because one Advantage plan might give you, say, $500 a year towards your dental coverage. Another might give you $1,000. Another might give you $2,000. So we do want to dig a little bit deeper and see how robust those benefits are that they're saying are so great. So now you cannot pick up a supplement in order to cover the copays that an Advantage plan has for you. Okay. Now, as long as we talked a little bit about Advantage plans, let's talk about your other option, because when you go on Medicare, you really have 2 options. Okay. So one option, after you pick up A and B, because that you have to do no matter what. But after you pick up A and B, you could certainly say, I want a Medicare Advantage plan, and where you have all these benefits in kind of one ball, right? Or what you could do is keep A and B as your primary and pick up a supplement as your secondary. And then we would also need to pick up prescription drug coverage. And if you want dental and vision coverage, that would all be just add-on policies, because going the route of the supplement is more of an a la carte type of deal. So A and B is your primary, and the supplement is secondary. Now, even though a supplement is put out by a private insurance company, they don't get a choice in the matter. So what I mean by that is if A or B says that they are going to pay any part of whatever inpatient or outpatient service it is, then your supplement doesn't get to deny. They have to be on board with any of those services based on the supplemental plan that you choose. So the analogy that I use for going the supplemental route is like a tractor and a trailer. A and B, your primary, that's your tractor, okay? And the supplement is your trailer, it's secondary. And what that means in medical terms is you can go to any doctor, anywhere, anytime, and you don't need a referral for a second opinion. As long as you go somewhere in the country that accepts and bills Medicare, and Medicare gets through the door, your supplement will get through the door. But the supplement, again, it only works with A and B. So that's why we would need to pick up a standalone drug plan. And if you want dental and vision coverage, we would have to pick those things up. Now, how else does a supplement compare in relationship to an Advantage plan? So let's run right back down this list here. Again, in the supplemental world, A and B is the primary, the supplement is secondary, which means there really aren't any networks outside of just making sure you go somewhere that accepts and bills Medicare. Now, when it says an Advantage plan is optionally renewable every year, in the guidebook that's put out by the Commissioner of Insurance in the state, it says that supplemental plans are called guaranteed renewable for life. So basically, as long as you're paying your premium for your supplement every month, then the plan can never go away, right? It actually auto renews every month you're paying that premium. So a supplement is kind of the opposite of an Advantage plan, right? Where an Advantage plan is pay little to nothing up front and have a max out of pocket, and you're paying as you go. In the supplemental world, you are paying a premium on the front end and you're paying less out of pocket as you go. Now, there's pros and cons to both of these, right? So in the supplemental world, if you're a really healthy person, then you're paying that premium and hopefully you're not having to use it, but that premium is going to be gone no matter what. And premiums, they go up. That's kind of the nature of the beast. Medical inflation, age inflation, no company can get away from changes to their premium structures, okay? But a supplement is going to be more of a pay up front, pay less as you go, okay? And then we have to pick up other things. Now, Again, a supplement, they can't cancel on you. It doesn't matter how much money you are costing them, as long as you are paying that premium every single month, then the plan is actually auto renewing. And the plan that you pick, so let me give you an example. When Medicare Part B says it's going to pick up 80% of an outpatient service, if you pick a supplement that says it's going to pick up the 20% that's left behind, the structure of that plan that you pick, that will never ever change unless you do something to change your plan. Okay? Because it's auto renewing every month. So it doesn't matter what Medicare changes, it's premiums too and copays too. 20% is still 20% of whatever Medicare leaves behind. Okay? Now, a lot of people are going to ask me, what about my ability to switch? Can I switch anytime I want, or can I switch, during open enrollment? And my answer to that is everybody's favorite, maybe. It depends. So follow me on this, and these are all the laws and the rules as we know them today. So let's say you start in the world of the supplement, okay? You go with a Medicare supplement policy, and you go with company A. Again, that plan, it's auto-renewing every month. So let's say a couple of years goes by, and you say, Ben, I don't like supplemental company A anymore. I want to move to supplemental company B. Well, we can do that anytime you want throughout the year. We don't have to wait until the end of the year during open enrollment. However, in order to switch from company A to company B, you will have to health qualify, because now you're outside of any sort of enrollment period. So in order to jump from supplement to supplement would require health qualifications. And companies are going to ask you a whole bunch of questions, and they can decide if they want to take the risk on you or if they're going to deny you and say, we don't want to take that risk on you. Now, if you start with a supplemental plan, and let's say you want to move into the Advantage plan world. Well, at this point in time, Advantage plans, they don't health qualify. Now, we may have to wait until the end of the year during open enrollment. Then we just pick an Advantage plan that allows you to see the doctors you want to see and go to the facilities you want to. And then that Advantage plan will start January 1st of the next year for you. And we just drop your supplemental plan. Now let's reverse all of this. Let's say you decide you want to start in the world of the Advantage plan. Within the first year of picking that Advantage plan, let's say you get buyer's remorse and you say, I really think we should have gone the supplemental route. Within that first year, at any time, we can put you onto a supplemental plan the first of the next month, no questions asked. Okay? But if you've been on an Advantage plan for longer than 1 full year, and now you want to get out of it and go into the supplemental world, well, now we have to wait until the end of the year during open enrollment. So that's October 15th to December 7th. And those supplemental companies, they are going to health qualify you, and they can decide whether or not they want to take you. Now, if they accept you, then your supplemental plan will begin January 1st, and we would have to pick up a drug plan for you to begin January 1st as well. Okay. Now, Advantage plans, that is something, if you are in the world of the Advantage plan, every year at the end of the year, I highly recommend that we review your Advantage plan. Because of all the changes that can happen, we want to make sure that 1, your plan is still available. 2, that the benefits within your plan and all the changes that were made are still beneficial for you, or is there another plan, whether it's within the same company or with a totally different company, that would be better for you. So that's something we should review every single year. Now, if you go the route of a supplement, like I said, we would have to pick up a standalone drug plan. Okay? A drug plan, that is something that we would want to review every year. We don't have to review the supplement every year because it doesn't change. Premiums will change and you'll be notified in advance, but the structure of the plan, that doesn't change. However, with drug plans, those change. Okay, so let's talk a little bit about drug plans now. So Part D, prescription drug coverage, it is only for prescription meds. It's not for over-the-counters or vitamins or any of the other things that you see on the list at the bottom of the page there. And again, this is something that I can't stress enough how important it would be to review every single year because there are a lot of variables. When I started doing this roughly a dozen years ago, there were roughly 34 standalone drug plans in the state of Wisconsin, and every year that number has changed. This year, there are 10 standalone drug plans offered in our state. And along with the number of plans that are being offered, premiums change, deductibles change, how they cover every individual med changes, your med list can change, the pharmacies that they have agreements with can change. So tons of variables there. And if we aren't paying attention to that, then that could mean a significant impact on your pocketbook. So I highly recommend Advantage plans and drug plans. Wherever you're at, those are things that need to be reviewed every single year during open enrollment, which is October 15th to December 7th. So real quick review, again, Medicare A and B, it's an uncapped liability. So you can certainly stick with that. In my opinion, I would absolutely want to pick something else up that gives you a cap or a max out of pocket. That could mean adding a supplement. That could mean going to privatize Medicare or going with an Advantage plan. If you go the supplemental route, we would need a prescription drug plan. Now, everybody is going to be different. And one of the things about Medicare that is nice is that it's all individual. So now you can pick a plan just for you. You don't have to try and figure out how you're going to pick a plan that encompasses you and a spouse or you and the whole family. You get to now be selfish. You can pick a plan that is solely for you and what your medical needs are and what your financial needs are. Okay? And that's what I do. That's my goal, is to figure out, how do you use your health insurance, right? What are your medical needs? What are your financial needs? We want to make sure we find a plan that is financially sustainable for you. So what else can I do for you? Well, I'm contracted with a number of different companies, really most of the major players that are either in the Advantage plan world or the supplemental world. And there are companies that offer one or the other and some that offer both. So I can sift through all of that for you, okay? Because if you go and try to contact every company, now all those companies are going to be contacting you. They're going to call you. They're going to email you. So if you don't want to get inundated any more than you already are, because when you're turning 65, you're one of the most popular people around. Everybody knows you're turning 65, and your mailbox is going to be busting at the seams. And most of it is all solicitation. I do caution you to be very careful and make sure that you sift through all of that mail, as I did have somebody accidentally throw their Medicare card away one time. It was just lost in the mix of all the stuff that they were getting. So definitely be a little bit careful, but I can help sift through all those different companies, all the different options, the rates, what do companies do that might be better than other companies. So, and then helping review those plans each year. So thank you so much for joining. Now, some questions that are frequently asked. Let's go through a few of those. So I talked to a number of people who are former veterans, okay, or who are veterans, I should say, and thank you so much for your service. So if you are someone who has VA eligibility, the first thing that you're going to want to find out is, what is your priority level? Because there are 8 different priority levels within the VA, and it's all determined based on your level of coverage or level of disability that they put you at. And that priority level is going to help determine how much more you need, okay? Because if you are in a priority level 8, then you're not getting a whole lot of help from the VA. So you might need a lot more services than maybe somebody who is in a level 1. So that's something that you're going to want to discuss with the VA, figure out what priority level you're at so that we can plan accordingly, okay? The other question with the VA is going to be, how much do you plan to use the VA? Are you going to doctor exclusively there, or do you plan to not use it a whole lot? Because that will also dictate some of the options and choices that you want to make moving forward. Another question a lot of people will ask is if you are a state of Wisconsin employee, and maybe you have a whole lot of accumulated sick leave that is built up, okay? And that's great. That's fine. You've got that accumulated sick leave or that bank of money that is now going to help pay for your secondary coverage, essentially. Now, for those state employees, your primary contact is going to be ETF, employee trust funds, because they're the ones that are helping navigate all that and activate it and get you your options. So while you have that sick leave, there's really nothing that I can do for you. You are going to have to enroll in A and B because that will be primary. And then your sick leave will pay for the options that ETF offers you. Now, when that sick leave is going to be running out, and ETF will be sending you letters constantly to say, here's how much money is left in the account, here's how long we think it'll take you. But then they're going to send you a letter when you're roughly 3 to 4 months out. And that's the time when we're going to want to talk and figure out, okay, what do we do when that money runs out? And what are your options from there? Okay. What if you are a former federal employee? Again, that is something where there is a federal employee health benefits handbook, and it has pages upon pages of frequently asked questions that I think will be very beneficial in determining if you want to stick with that coverage. Will you take all the different parts of Medicare? How do you want to go about doing that? So I highly recommend getting your hands on that federal employee handbook and reviewing those questions to see if you want to stay with the federal benefits or if you want to go full bore into Medicare or what you want to do with that. But that your primary contact would be going through the federal benefits, or those that are administering the federal benefits. So I think that's OPM. Okay. Another question people ask me is, when is the best time to contact me and the best time to meet? So I understand that there are a lot of planners out there, and that's great. However, in the state of Wisconsin, the law for us to be able to start enrolling you in Medicare or in any of the other options that are out there, the earliest we can do that is 3 months prior to when you need it to start. Okay. Now, if you're going to start Medicare when you're turning 65, Medicare is going to begin on the first day of your birth month. Okay. So if you were born anywhere from the second day of the month to the 31st, it will always begin on day 1 of your birth month. If you were born on the first day of a month, you actually get to start a month ahead of time. Okay. Now, again, the state of Wisconsin says we can start the process 3 months ahead of time, and that is plenty of time. And I would absolutely utilize those 3 months ahead of time. But starting then will ensure that we have all of the most up-to-date information and all the most up-to-date premiums and benefit structures. Starting well before that, then we might have to kind of start over and get all those changes. So trust me when I say that starting 3 months ahead of time is plenty of time. Okay. So if you have an April birthday, somewhere from the 2nd to the end of April, then we can start that process right away in January. Okay. So if we connect 4 months ahead of time, we set up a time right away when we're inside those 3 months, that is going to be plenty of time to make sure that we get your enrollments done. We go through all of your options, gives you time to think about it and make sure that we understand, all the different options and that we find the best thing for you moving forward. Okay. So I hope you found this very helpful. I truly appreciate you watching this and joining us. And I would love the opportunity to help you out and make sure that we find the best plan for you and your medical needs and you and your financial needs moving forward. Thank you so much. Feel free to contact me anytime. And if you know anybody who needs help going through the Medicare process, feel free to give them my name and number or my email address here on the page, and I would be happy to help them out. Thank you, and have a great day.